Good afternoon, ladies and gentlemen. Welcome to Medcast, our health segment where we highlight expert perspective on a variety of medical topics. Today, we are joined by Dr. Ali AlAjmi, a distinguished dermatologist who specializes in diagnosing, treating, and preventing skin conditions of all kinds. From routine skincare tips to innovative procedure for more complex issues, Dr. AlAjmi, who is a fellow of Johns Hopkins University in complex medical dermatology and Canadian and American board certified dermatologist, will be sharing valuable insights on how to keep our skin healthy, vibrant, and protected. Welcome, Dr. Ali.
Thank you so much for having me.
We are so honored to have you, Doctor.
Pleasure is
Dr.
mine.
Ali, all the people have the idea for, let's say, the minimal idea for the dermatology is a very simple major.
Mhm.
So, could you please give us more insights about what is dermatology and what is it specialized in?
Okay, thank you. That's an amazing question. Actually, dermatology is one of the hardest specialty among all medical specialties because of two reasons.
Hmm.
First of all, the morphology or the pattern of skin rashes, we have only nine morphological patterns.
Hmm.
Like we have papule, and then when it's bigger, it's plaque, and then when it's filled with water, it's bulla. So we have nine. And then according to the Journal of European Academy of Dermatology, there's 3,000 diseases. So out of nine patterns, you have 3,000 diseases. So a lot of similarities. That's why it's very complex to reach and to diagnose skin problems. And it's really hard, honestly, even after 5 years of training in dermatology, you're still building your experience, you're still building your pattern recognition skill, and it takes time. Even the biggest dermatologist I ever worked with, even after 15, 20 years, they still have this doubt, uncertainty about many conditions. And it's even after doing the biopsy, there is still a doubt. So it's really hard and tough specialty.
Okay, that's a very great answer. But however, yet some people think diagnosing these diseases is very simple, and they also think the diseases you deal with also have simple treatments. That's why probably I would say we are in the country of thousands dermatology. So everyone can give you an answer for any signs or symptoms they see on the body. Is it that easy to diagnose any, or even do you have like complex cases of dermatology?
Yeah, actually, yeah, again, it's really complex to reach the right diagnosis because
Mhm.
of the patterns that I told you.
So it's not like about only using corticosteroids or only creams to
Not
treat
really,
something.
not really. Actually, to treat, to jump to the treatment, to treat perfectly or to treat correctly, you need to diagnose correctly.
Hmm.
I think that's that's my approach.
Hmm.
I don't treat without diagnosing. So you have to go through that. Sometimes it's really hard to diagnose because of a lot of similarities. We have dermatoscope. We look with the dermatoscope, and this will narrow our differential diagnosis. And then when we stuck with five, six differential diagnoses, we can do skin biopsy.
Hmm.
And then when we do the skin biopsy, we look under the microscope, we see what type of cells. This is also will narrow our differential diagnosis. So based on clinical exam, dermatoscope, and then biopsy, you can reach the diagnosis and then you can start treatment. But it's really, I don't think it's a good approach to just give corticosteroid and see the response. That's not really a safe approach.
Especially our friends, sometimes they share the creams for different, as you said, for different diagnoses. And also, I think and I believe you would use some systematic treatments rather than just using the topical ones. Is that right or not?
Definitely.
Yeah.
So in the past, dermatology was only creams,
Hmm.
topicals,
Yeah.
like in the old days. And then they started to have medication pills in the mouth.
Hmm.
And then we start to have injections, like the biologic injections to treat a lot of conditions. Nowadays, I think we are in the golden age of dermatology, especially medical dermatology.
Hmm.
Many cases, many conditions we didn't have treatment in the past. Like, for example, psoriasis. It was really hard to be treated before. Creams, and then you can't cover the whole body. And then now, with the treatment of biologics, we can really treat psoriasis. Vitiligo, alopecia areata, one
Hmm.
of the challenging conditions. Now, with the new agents like the JAK inhibitors, we can actually control those conditions really in a very good way, and we can improve the patient quality of life.
Okay, that's very great. Now, regarding the skin health, I believe the skin health is very vital and important for the overall health of any patient or even any human. However, some people might think to use unlicensed products, especially those who are buying from the social media. When they hear about the mixtures,
Mhm.
they want to use it, and they think they are very effective in making their skin healthy. First of all, I need you to emphasize on the statement that is the health of the skin is important to the patient or to anyone, and about the use of the unknown mixtures.
Definitely. The skin, first of all, it's the biggest organ in the body.
Hmm.
Okay. The skin is actually the mirror of our internal organs.
Hmm.
We can diagnose internal organ diseases and internal problem and systemic diseases just from the skin.
Hmm.
And it can be the first sign of this internal diseases. So the skin is like important organ. Using creams or medications from the social media promoted by people without medical background, it's really dangerous. The problem is we don't know what's exactly the ingredient of those creams.
Yes.
That's big problem, especially with whitening agents.
Yes.
And I see this a lot in the clinic. Like you see this patient coming to you with this complication from whitening product. They saw this ad on Instagram or TikTok saying, "Wow, this is the best cream. It can look before and after." And they show them
Yeah.
picture of before and after. It's like convincing, but they are using really strong topical steroids
Yes.
inside those ingredients, and then they don't say there is a steroid here because steroid is a miracle.
And they always say it's based on natural ingredients.
They will tell you that
Yeah.
it
Yeah.
will natural. It's like a natural ingredient,
Uh,
but they won't because corticosteroid is like a miracle.
mhm.
Honestly, if you put it on anything, it can treat it.
Yeah.
But at the long term, there is a lot of side effects. You
Yes.
can have depigmentation. You remove the pigment of the natural pigment of the skin. You can actually dilate the blood vessels. The face will be red,
Hmm.
like red, and you cannot treat this with any creams
Hmm.
if it's red from long-term using of those creams. So I think it's really dangerous to use creams or prescriptions or medication from the social media without knowing what's the ingredients.
As well as it may have also systemic side effects. And I
Definitely.
think you agree with that. So, Dr. Ali, let's speak about something specific, which is the latest, let's say, updates we have in the dermatology field, which is the use of some machines such as the lasers. Some people think that in dermatology field, you only use the lasers for the hair removal. Is that right or not?
That's absolutely wrong. Laser hair removal is one of the amazing technology
Hmm.
that's used, but in dermatology we're using laser on many conditions.
Hmm.
Okay, I would classify them to different categories. Hair is one, and
Hmm.
it's important, and then we have vascular category, which is the birthmark, the port wine stains, and also we can treat rosacea,
Hmm.
which is the redness of the face. And then we have the third category, which is the pigmentation.
Hmm.
We can treat darkening of skin. Sometimes you can have a melasma, post-inflammatory hyperpigmentation after trauma or after a burn. This is also can be treated by laser. And then we have the fourth category, which is the resurfacing. If you have scar, like acne scar, you can treat it with the CO2 lasers. And this is like the fourth category of laser. So a lot of actually indications can be used in
Could it be
lasers.
used as well for the like post-surgery scars as well?
Definitely,
Yeah.
definitely. Like post-surgical scar, we can combine different kind of lasers to improve the texture,
Hmm.
to improve the tone, and also the thickness of the scar. It can really improve. It can do a lot of things like in lasers.
Now, if the patient is deciding to use one of these machines by the expert or by the dermatologist,
Mhm.
is there any certain instructions you would give to the patients before they come to the clinic?
Definitely. First of all, you have to be sure that the person was trained to use the laser because laser can be really dangerous.
Hmm.
Dangerous to the eyes, it can cause blindness, dangerous to the skin, it can burn if they use the wrong settings. So you have to be careful when you go to the clinic to choose the clinic that they are very well trained,
Hmm.
they are certified to use those lasers. That's the first thing. Other than that, in general, you have to avoid sun
Hmm.
after laser treatment because it can increase the pigmentation.
Is there any like kind of creams to be used in just in case, like sun protection or others?
Honestly, any sunblock can be good. My advice always to the patient, the best sunblock is the one that you're using every day.
Hmm.
If it was physical, it was chemical, the one that you stick to every day, that's the best sunscreen.
No, I mean after they finish the laser
Yeah,
procedure, would you use like any sort of creams or something?
just a moisturizer, just
Just
a
a
regular
moisturizer.
moisturizer. with sunscreen.
Hmm.
Yeah.
Okay, one more last question, Dr. Ali, because we are reaching to our end of the segment. And I know that question would need a very long answer and probably a very long research as well.
Mhm.
What do you think, as an expert, that the dermatological problems would have, like, let's say, psychological impacts on the patients?
I think that's true.
Mm.
The number one disease in the world now, it's acne, okay, which is one of the condition that is very common in teenagers
Yes,
and one of the common cause of depression.
yes,
So and then active acne and also the scar that can happen after the
yes.
acne. Depression, that means there's a suicidal
Hmm.
thoughts as well. So I think there is a big relation between the psychological impact and the skin, because it's the image. The skin is the image of the person,
Yes.
like the face. So if it was affected, it's really going to affect the self-esteem of the people.
Yeah,
Yeah.
well, the reason why I ask this question, people might think there's no link between the updates and the trends of the use of the machines and the psychological impact on any, like, from any dermatological problem on the patients. Otherwise, however, uh, if you need to, if there's no impact on the patient,
Hmm.
then let's say the big companies wouldn't think to improve or to invent new machines to
Yeah.
treat the dermatological problems.
Yeah.
Dr. Ali, we
Exactly.
were so pleased to have you, and we are sorry we have reached to the hour end of our segment. Hopefully, we can meet you again in another segment in the future.
The pleasure is mine. Thank you so much, Ali.
Thank you so much. Our dear viewers, we have reached the end of our segment with Dr. Ali AlAjmi. Hopefully, we can meet you again in the future with another medical specialist. Until that time, see you later.